This presentation was made by Jenna Mansell, and it is going to cover what is a healthcare delivery system. What is a healthcare delivery system? According to the Institute of Medicine, the healthcare sector in the United States consists of an array of clinicians, hospitals and other healthcare facilities, insurance plans, and purchasers of healthcare services, all operating in various configurations of groups, networks, and independent practices. This means that a healthcare delivery system is everyone that provides care, is insured, or provides insurance as or part of the healthcare delivery system. This is a need to increase communications between the different departments and organizations to achieve a smooth flowing system. The goal of the healthcare delivery system is to promote wellness through preventative care while providing treatment for a range of ailments, injuries, and illnesses. Preventive care seeks to mitigate the onset disease by encompassing all providers and facilities that administer care. Why is the healthcare delivery system important? Healthcare is not the only or even the strongest determinant of health, but it is very important. This is a quote from the Institute of Medicine, page 214. Without a healthcare delivery system, we would go back in time. There would be no systematic way to provide care for everyone without a healthcare delivery system. This is why it is so important, and we need it moving forward in our lives. Who are providers? According to Berkeley University of California, under federal regulation, who are providers? According to Berkeley University of California, under federal regulations, a healthcare provider is defined as a doctor of medicine or osteopathy, podiatrist, dentist, chiropractic, clinical psychologist, optometrist, nurse practitioner, nurse midwife, or a clinical social worker who is authorized to practice by the state and performing within their scope of practice as defined by state law, or a Christian Science practitioner. A healthcare provider also is any provider whom the university or the employee's group health plan will accept medical certification to substantiate a claim for benefits. So, a healthcare provider is a highly trained and qualified individual or organization that provides medical care, treatment, or related services to this patient. This is a picture of all the providers at our rural health clinic that we built last year. Um, I just thought it showed a good variety of all the different people who could be providers. What do healthcare providers do? Healthcare providers work tirelessly to diagnose and treat illnesses, injuries, or other medical conditions, and to help others manage their health and maintain a high quality of life. Healthcare providers take care of you when you need it most. If you have an accident and end up having to go to the emergency department, it will be healthcare providers who greet you and will take care of you all the way up until you are discharged. According to the Interprofessional Education Collaboration, these are roles and responsibilities that are needed to be a healthcare provider. First, you must communicate one's role and responsibilities clearly to patients, families, community members, and other professionals. 2. Recognize one's limitations in skills, knowledge, and abilities. 3. Engage with diverse professionals who complement one's own professional expertise, as well as associated resources to develop strategies to meet specific health and healthcare needs of patients and populations. 4. Explain the roles and responsibilities of other providers and the manner in which the team works together to provide care, promote health, and prevent diseases. 5. Use the full scope of knowledge, skills, and abilities of professionals from health and other fields to provide care that is safe, timely, efficient, effective, and equitable. 6. Communicate with team members to clarify each member's responsibilities in executing components of treatment plan or public health interventions. 7. Forego interdependent relationships with other professionals within and outside of the healthcare system to improve care and advance learning. Engage in continuous professional and interprofessional development to enhance team performance and collaboration. 9. Use unique and complementary abilities of all members of the team to optimize health and patient care. 10. Describe how professionals in healthcare and other fields can collaborate and integrate clinical care and public health interventions to optimize healthcare population. Healthcare inequities access. Healthcare inequities are systematic differences in the opportunities groups have to achieve optimal health, leading to unfair and avoidable differences in healthcare outcomes. The dimensions of social identity and location that organizes or structures differential access to opportunities for health include race, ethnicity, gender, employment, and socioeconomic status, disability and immigration status, geography, and more. This means that your location and social identity shouldn't be a reason for you to have poor health outcomes. The provider should make sure that you're getting adequate care. If you aren't in the setting that you are currently in, then you should be transferred. The insurance providers and payers should also work to expand networks in rural areas in which they sell coverage. I have found that this is not done appropriately and leads to undercoverage for lots of patients. What are healthcare settings? When a patient needs medical care, they're either going to have two options: inpatient care and outpatient care. With inpatient care, a person is admitted to the hospital to stay overnight. With outpatient care, a patient goes home following treatment or a procedure. Inpatient care may be more expensive than outpatient care. According to a study in 2018 for the Institute of Health Metrics and Evaluations at the University of Washington, the inpatient stay in the United States in 2016 cost more than $22,000, while the average outpatient visit costs $500. That's a big difference if you're getting the same amount of care. I found this chart from Arise Rehab Treatment, but I thought it did an excellent job in showing the difference between inpatient and outpatient care. Inpatient services. According to Blue Cross and Blue Shield, inpatient care refers to medical care that is provided to the patients who are admitted to the hospital or other healthcare facilities such as rehab centers, mental health centers, or addiction treatment centers. The decision to provide inpatient care is made by the healthcare provider after assessing the patient's medical conditions and needs. This type of care involves 24/7 monitoring by medical professionals, specialized equipment, and access to a range of medical services. This type of treatment and therapies provided during inpatient care may vary depending on the patient's medical condition and requirements. The decision to provide inpatient care may also have an impact on the patient's insurance coverage and out-of-pocket expenses. Um, the patients must meet inpatient criteria according to the insurance companies for them to pay for inpatient care. Um, Now, a lot of insurance companies are preferring outpatient care because of the lower cost. Advancements in the medical treatments and procedures mean that many surgeries and treatments can now be performed on an outpatient basis rather than requiring patients to stay in the hospital for extended periods of time. Not only does this offer a more convenient and flexible option for the patient, but it can also provide several advantages over traditional inpatient care. One of the key benefits of outpatient care is that it is typically less complicated than inpatient care, with a focus on less invasive procedures that can be easily scheduled and accommodated. This is this can help to reduce the stress and anxiety that patients may experience when undergoing medical treatments, as well as limiting the amount of time they need to take off work and away from their daily routines. When you're thinking about outpatient services, think less critical. Um, the examples of this are home health, infusion clinics, wound care, outpatient therapy such as physical therapy, occupational therapy, and speech therapy, and outpatient dialysis. These two services provide care for individuals that should provide all the care they could possibly need. Inpatient when things are critical and need constant monitoring, and outpatient when you're on the mend, providing PT, OT, ST, and nursing care in the homes or outpatient settings to provide the optimal care for this patient. There are several private health insurance options available, including voluntary and employment-based insurance. These are offered by commercial insurance companies and managed care organizations. Nonprofit Blue Cross Blue Shield associations also provide similar services, and some have their managed care organizations. Certain companies use insurance companies to provide stop-loss coverage while self-insuring. Group insurance, which is obtained through an employer, union, or professional organization, is less expensive than individual health insurance. Health insurance benefits are not subject to income tax, which make them more valuable. Primary medical insurance covers catastrophic situations. Health insurance coverage has been comprehensive since the 1970s. The Affordable Care Act, the ACA, required preventive and wellness services to be included in health insurance. However, comprehensive coverage has increased the cost of health insurance. Private insurance outside of group plans is a form of healthcare insurance that is used by approximately 6% of American population. This type of insurance is particularly popular among self-employed individuals, early retirees, and those who do not have access to employer or government-sponsored plans. In the past, obtaining private insurance was a major challenge for high-risk individuals. They often face significant hurdles such as higher premiums or being denied coverage altogether. However, with the introduction to our Affordable Care Act, the ACA, this obstacle has been removed. The ACA prohibits insurance companies from denying coverage to individuals with pre-existing conditions, making it easier for high-risk individuals to obtain private insurance. Managed care organizations, MCOs, such as healthcare maintenance organizations, HMOs, and preferred provider organizations, PPOs. It's a lot of O's, but they emerged in the 1980s as a response to the rising cost of healthcare. Initially, MCOs were less expensive than traditional insurance plans, making them an attractive option for many consumers. Over time, they become more popular, and conventional insurance companies also started offering managed care plans. Today, managed care plans are the most common form of health insurance. In 2019, about 49% of companies provided PPO plans and 26% offered HMO plans. Managed care plans typically offered lower out-of-pocket costs and more comprehensive coverage than traditional plans. However, they also come with restrictions such as a limited network of healthcare providers. In summary, private insurance outside of group plans is an important option for many Americans, particularly those who are self-employed, early retirees, and do not have access to employer or government-sponsored plans. The introduction of the ACA has made it easier for high-risk individuals to obtain insurance. Meanwhile, managed care plans have become increasingly popular and now most common form of health insurance in the United States. Who are the purchasers? There are government-funded programs like Medicare and Medicaid. I found this picture online, and I thought it showed a good example of the differences and the similarities between Medicare and Medicaid. A lot of people get these two mixed up. Medicare is for the elderly over 65, and they do have to pay deductibles and part of their coverage, but it's nationwide, federally funded. Medicare is state and federally funded, and it is for the poor, people with poor socioeconomical environments, and women who are pregnant. Who are the purchasers? Medicaid is a government program that offers health care services to low-income individuals. Taxpayers fund the program, and each state administered in line with federal guidelines. Medicaid expenses are shared by the state and government, and eligibility depends on income and assets. Some categories, such as family with children, individuals receiving SSI income, and children and pregnant women whose family income exceeds 133% of the federal poverty level, are eligible automatically. States may also establish a medically needy category. However, many doctors and healthcare providers do not accept Medicaid patients because of the low reimbursement rates. Medicaid payments are much lower than those of Medicare and private insurances. While the Affordable Care Act, the ACA, temporarily increased Medicaid providers' payment to Medicare levels, physician participation teams remain challenging the program. The U.S. Supreme Court has also ruled that Medicaid providers cannot use federal courts to compel states to raise reimbursement rates. Furthermore, beneficiaries frequently leave and re-enter the program due to changes in their eligibility, a phenomenon called churning. This happens because many beneficiaries' income fluctuates from month to month. States that have expanded Medicare under the ACA has experienced a reduction in the coverage disruptions, which is a positive development for Medicaid patients. This chart right here just shows the income with and without children, and if you are pregnant or not, to be eligible for Medicaid. Medicare is a federal health care program that provides financial assistance for medical care to individuals age 65 or older, those with end-stage renal disease, and disabled individuals entitled to Social Security benefits. The program was created in 1965 and has since been an essential resource for many seniors in the United States. The Medicare program is divided up into four parts: Part A, B, C, and D. Part A covers hospital stays, skilled nursing facilities, hospice cares, and home health services. Part B covers medical services such as doctor visits, outpatient cares, and medical equipment. Part C, also known as Medicare Advantage, is an alternative to traditional Medicare and includes coverage for hospital stays, medical services, and prescription drugs. Part D provides prescription drug coverage. While Medicare is a valuable resource for many seniors, it is important to remember to keep in mind its limitations. The program is associated with high deductibles, copays, and premiums, which can be a significant burden for many beneficiaries. Additionally, Medicare does not cover certain services such as dental care, eyeglasses, or hearing aids. There is also no cap on out-of-pocket expenses, which can further increase the financial strain. However, there are some relief options through Medicaid for those who qualify, employer retirement benefits, and Medicare plans, Medigap plans. Medicare is a joint federal and state program that provides health care coverage to low-income individuals and families. Medigap plans are supplemental insurance that provides policies that can cover many of the costs that Medicare does not cover. These options can alleviate some of the financial burden associated with Medicare and ensure that beneficiaries have access to all they need. When an individual has health care insurance, they are obligated to pay a portion of the actual cost of medical services out of their own pockets. This out-of-pocket expense is in addition to their share of the cost of the premiums, which they pay through payroll deductions. These out-of-pocket expenses come in the form of deductibles and co-payments, which are the only incurred when medical services are utilized. A deductible is the amount that the insured must pay each year before any benefits are payable by the plan. The purpose of the deductible is to ensure that the insured has some financial responsibilities for their healthcare expenses. Once the deductible is met, the plan will begin paying for benefits according to the terms of the policy. Co-payments are the fixed amount that the insured must pay for certain medical services. For instance, a plan may require a $25 co-payment for each visit they go to the doctor. In this case, the insured would pay the $25 for each visit, and the plan would be responsible for the remaining cost of the service. In summary, having health insurance does not mean that all expenses are covered. Individuals with insurance responsible for paying their portion of the cost of medical services out of their own pocket. This is why it is important to understand the terms of your insurance policy, including the deductible payments, co-payments, to avoid unexpected costs. And this is the list of references for all the information that was provided in this presentation.